we have been able to expand our service to new clients purely for forensic services and not part of a greater medical scheme package. And the key driver to that was having a big data analytical system that can deliver for us those insights that we require, because you're dealing with huge data sets. And you cannot do this on Excel or on rudimentary systems. It takes too long, it's too cumbersome, and you can't get those valued insights you need when you're dealing with we don't have a proper system in place. I'm Dr. Gregory Pratt. I'm the head of claims risk at Metropolitan Health. I've been there for 5 years, and part of that function was looking after the forensic unit.
Great. So, Greg, maybe you can share with us a little bit about what the situation or reality was before implementing Themis. Describe the kind of reality that your day-to-day, what were some of the challenges?
So I walked into this team, it was about 35 people, and they'd been using a different system for the last 5 or 6 years. And I found that hardly anyone was actually using it because it was too difficult to understand. And you actually had 1 or 2 people who were experts who everyone then relied on to get the information they wanted. So I was quite shocked that after so many years, a system's usage had actually declined, where you would expect uptake to ever improve, really. Or that's what you want to see with that large investment that you make. And so this system was just way too complicated and difficult to understand. So I quite quickly decided we can't go on like this. We need to find a different solution to help with their productivity, and also then decentralize the reliance on a data team to bring them the information.
So enters Themis. What were perhaps some of your early reservations or concerns?
So I think in any big corporate, bringing in something new is always difficult. So I really needed to find something that had a good balance between cost considerations and then in terms of productivity with the staff. So I got to hear of Themis, and I think the one thing I liked was that it had a long track record in healthcare, actually. It had been evolving over many years. It wasn't something brand new and just off the shelf. So I got to start looking into that, and it had a lot of nice features, which were totally different to the system that was already there. And then, of course, always dealing with a South African company is far preferred than dealing with an American solution, where you're trying to adapt it to South Africa.
We do have very specific nuances that we need to consider here.
Correct, yeah.
If you were sort of able to compare the impact on your internal users and your external companies that you ultimately deliver the service on, you deliver the service on their behalf, right? What were some of the early wins in terms of Themis over the previous solution that you had?
So the previous solution couldn't integrate all our clients across the multiple databases that we use. So it ended up focusing on one of the bigger clients and then extrapolating information to the others, but it didn't actually bring in their data. So one major aspect was that we could integrate all the client's data into one system and draw it from a source across multiple platforms. So for me, that was a big plus factor and something that can be done relatively quickly. It wasn't going to be a 2-year project to try and get it done. I think in terms of the team's value was really that they could have relatively instant access to information. It's no longer sending off a request for data, getting back a data dump, and then having to rework it themselves to understand what is the patterns they're looking for. It provided ready solutions and visual pictures, graphs, etc., that you can quickly interpret.
Right.
So I like that aspect a lot. And then, of course, in terms of external stakeholders, for even lay people, you could easily use those pictures and graphs to demonstrate to others what message you're trying to bring across, or what intelligence you're bringing out of the data.
It is all about the insights, isn't it?
Correct. Yes.
Yeah.
You can have, and we do, millions and millions of lines of data. But if you don't know how to intelligently extract meaningful information, you end up maybe in analysis paralysis sort of thing, because you're not quite sure what the data is telling you.
Yeah.
And you rely on that data to take actions and make decisions.
So how would you describe your reality today? Again, looking inward to the team that is still responsible for this function and the impact that you can deliver to your external customers.
So we have been with Themis now about, I think it's about 2.5 years on the one part that we initially did the pilot on. And then we took it over to our biggest client for, I think it's about 1.5 years now. So that journey has been continually evolving, because Themis is adaptable and you can continually enhance it to bring even more value and productivity into your team. So I've seen that the team has almost universally now, they're all using it compared to before where you had hardly anyone. They're all using this system, and they are able to incorporate these into their own reporting mechanisms and outputs that they need to deliver. And even they can, with some confidence, bring that message across to those clients themselves. They don't need to say, no, let me go and call the expert first.
Sure.
Tell me what the numbers are saying. They can show it, so it's improved their outputs.
And I'm guessing the fact that it also works with any data source has also contributed extensively to the pervasive use and the ease of use for the users.
Yes. As I said, we service about 14 different client schemes. So from historical reasons, we had them on different IT platforms. So you have to bring this all together into one place so you can understand the broader picture and really get those meaningful insights out of the data.
So what is it that you would typically recommend to another organization that might find themselves in a situation similar to before Themis, in terms of guiding them to say, what are the steps you need to take? What are the considerations when making decisions to move from the current reality to an imagined future that perhaps delivers more value?
I think you have to really make a good assessment of what your current systems are delivering for you. What are the gaps? Has it evolved? Has it kept up with new developments? Is it delivering that insight that can help you push your business further? Because if it's stagnant and if it is not growing or evolving as your customer journey evolves, then you need to find a different solution.
So last question, Greg. So we have this model that we call software with a service that compounds the expertise of people from the forensic space with the solution. Has that contributed at all to the adoption of the user landscape and the manner in which the users have been able to really maximize the value?
Absolutely. One thing we used to struggle with was having to deal with an internal IT team that's serving a bigger corporate business and is not really focused on serving a forensic team. You need to be self-reliant as much as possible because you can't tolerate those long delays getting buy-in from others. So being able to engage the Themis team directly and having them on tap really allows the fast evolution of the system and corrections and where you need enhancements that can be easily done because the team is focused on delivering that solution. And we've really benefit from that relationship. And I think, the Themis team also, we've taught them a lot about our business and how it functions and how you really must use that tool to have maximum benefit because you don't want it to just be another tool. There's a significant financial cost to it, and you must make sure that delivers a return for your team and for the ultimate customer satisfaction you're trying to deliver.
Has to be a value exchange, right?
Absolutely. There's But that team that can help us with that integration, the continual data niggles that arise when you're dealing with so many different systems. You need to have urgent responses and people who understand really what they are doing, so that they can turn your desired outcomes into reality through this tool.
Yeah.
So we have been able to expand our service to new clients purely for forensic services and not part of a greater medical scheme package. And the key driver to that was having a big data analytical system that can deliver for us those insights that we require, because you're dealing with huge data sets. And you cannot do this on Excel or on rudimentary systems. It takes too long, it's too cumbersome, and you can't get those valued insights you need when you're dealing with we don't have a proper system in place. So that system has allowed us to grow outside of our current scope. But also for our current clients, it's been able to deliver an enhanced output that we even present, at executive level when we're dealing with highlighting problems in the claims payment space. Yeah.
Greg, thank you so much. This has been a privilege for me. And on behalf of the team, I also want to thank you and your organization for the insights that you've plunged back into our business, allowing us to continuously grow, evolve, and reimagine that future. Thank you so much.
Yes. Thank you so much. Cool.